Rule 3. Answer every question keeping in mind that you're an FY1 doctor. The most appropriate answer will be the one which will be appropriate for a doctor at your level to perform. So, a lot of the times, a lot of the questions have options that all seem correct, that all seem like they could be appropriate, and you have issues ranking them. And that's mostly because they're trying to trick you, and there's only one option that's appropriate for an FY1 to do. It's about thinking at your level and knowing what is expected of an FY1 doctor and what is not expected of an FY1 doctor, what is not your job, and what discussions you must or must not have. So, keeping that in mind, let's go on to the next question. You're looking after Mr. Coursera, who has previously been treated for prostate carcinoma. Preliminary investigations are strongly suggestive of recurrence. As you finish taking blood from a neighboring patient, Mr. Coursera leans across and says, "Tell me honestly, is my cancer back?" Rank in order the appropriateness of the following actions. So pause here and make your decision. The answer is D, C, E, A, B. Let's now discuss why that is. So the most appropriate is D. You inform Mr. Coursera that you will chase up the results and you will ask a senior colleague to discuss it with him, as opposed to C, which is to chase up the results and speak to him on your own. So I know we said that, solve the problem and solve it yourself if possible, but again, it's important to see who you are and what level you are at. An FY1 doctor is not expected to have breaking bad news conversations or to talk about something as niche as prostate carcinoma and talk about its management and diagnosis and treatment. So it would be more appropriate to chase up the results for him and then ask a senior colleague to discuss it with him, because the kind of questions you're going to get are, doctor, am I going to die? What is the survival rate? What is the chemotherapy regime? And these are just things that you will not know. So D is the most appropriate option, and then comes C. Why is E after C? So E is to invite Mr. Coursera to join you and a senior nurse to have a conversation and answer his questions while someone else is holding your bleep. So, number one, again, you're an FY1 and you don't know anything. Remember that. And so you can't sit there with this patient and answer his questions about prostate carcinoma because you are just not knowledgeable enough. If you had said that, you'd invite him with a nurse and get a senior colleague to talk to him and address his concerns, that would be much, much better. And that would be very appropriate. But here it's not. And also another thing in this option that makes me want to not choose it is to get a colleague to hold your bleep. This means you're on call, and normally the bleeps you receive are extremely sick patients, extremely unwell patients, and to put that responsibility onto someone else to have this conversation is very, very inappropriate at your level. So hold on to your bleep and do not have this conversation. But it is much better than the rest of the two, which is A and B. Now, A is to explain to Mr. Coursera that the cancer has come back, and B is to reassure him that he'll be fine. Both of these are absolutely inappropriate and very wrong because you only have the preliminary investigations. You really still don't know if the cancer really has come back or not. So both are wrong, but A is still better than B because to blindly reassure Mr. Coursera that he'll be fine is the worst option. It's absolutely inappropriate. This is also a rule further ahead that you should never be blindly reassuring a patient when something could really be wrong, because it gives them this false reassurance and hope, and that's never what the GMC wants you to do. So it would be better to explain that his cancer has likely come back, although still very inappropriate because you don't have the results on you, and it could be that he hasn't had a recurrence, but to just reassure him blindly would be the absolute worst option. You can now pause and read the UKFPO's explanation for the answer. And let's move on to another question, also regarding Rule 3. You're on duty at night and see a patient, Mrs. Penn. Mrs. Penn has developed sudden shortness of breath and signs consistent with acute pulmonary edema. You've managed this condition successfully before. However, the nurse in charge of the ward wants you to call the specialty trainee to come and see Mrs. Penn. You're aware that the specialty trainee is currently in the ED caring for a sick patient. Rank the appropriateness of the following options. Pause and do your ranking, and then let's discuss. So the answer is B, C, A, E, D. And let's discuss why that is. So the most appropriate would be B. That's because you make an initial assessment, administer appropriate treatment, and then inform the specialty trainee. This is clearly a patient who is deteriorating quickly. She's had sudden shortness of breath, and this is an emergency. So the first thing would be to go through your ABCs and give her the appropriate treatment, then inform your specialty trainee. So the nurse wants you to call the specialty trainee, and you've done that, but you've basically handled it in a proper manner. You know, you've gone through the A&Es, and you're making sure that the patient is stable before you call and ask for advice. The next appropriate option would be C, which is to telephone the ED and ask your specialty trainee for advice. This would waste a little bit of time because you've left a desatting, ill patient and come to the phone. You might or might not get them in time, but you do consult them as the nurse in charge would like. And so this is more appropriate than the next option, which is A, to explain that you've managed this patient before and you can care for her. So here you're getting it done in a timely manner, but you're not getting the specialty trainee involved, and you're basically kind of not listening to the nurse and disregarding what she's saying, which is not going to go down well. The next option would be to go to the emergency department and explain the situation to the specialty trainee in person. Now, this might seem excessive, and it's wrong. It is less appropriate, but it is more appropriate to involve the specialty trainee, although late and leaving an ill patient, than to be arrogant to the nurse, like D suggests, that you can take responsibility for Mrs. Penn on your own and your decisions on your own, and you can handle her. You're basically disregarding the nurse, you're being arrogant, and you're not taking into consideration what she's saying. And you may not be equipped to handle this patient. You don't know. They have more experience than you. So you shouldn't disregard what they're saying. And, you know, options like this where you're being arrogant or, you know, causing a rift between you and the staff will never go down well. So pause and read the UKFPO's rationale, and then let's move on to rule number 4.